Welcome to Research Roundup by Integrated Benefits Institute, the podcast where we dive into the latest trends and research in the workplace health and productivity space. I'm your host, Dr. Sarah Lee Gurlau. Each episode, we will bring you the most recent studies, insightful analyses, and actionable takeaways to help you create a healthier, more productive workplace. Whether you're an employer, a benefits consultant, or a vendor, this podcast is designed to keep you informed and ahead of the curve. Let's get started. Thank you for joining me for episode 2 of Research Roundup presented by Integrated Benefits Institute. In today's episode, we'll be exploring some fascinating studies from July 2024 that offers really valuable insights for employers. Let's dive in. Our first study is entitled Work Loss Among Privately Insured Employees with Overweight and Obesity in the United States, published in Obesity Science and Practice. This comprehensive research analyzed data from over 700,000 employees over a 5-year period using the Meritive MarketScan Health and Productivity Management database. The results are striking. Employees with higher BMI categories experienced significantly more work loss across multiple dimensions. For instance, those with obesity class 3 had 36 more hours of absenteeism annually compared to employees with normal weight. This translates to nearly a full work week lost each year. But it's not about just absenteeism. The study also found that employees with higher BMIs had increased costs related to short-term disability, long-term disability, and workers' comp. For example, obesity class 3 employees had $623 higher short-term disability costs annually. These findings suggest that employers may face higher operational costs and reduced productivity in workforces with a high prevalence of obesity. It underscores the potential financial benefits of investing in employee health and wellness. A practical step for employers could be implementing a subsidized, healthy meal program in the workplace to promote better nutrition choices among employees. Next, we have a study from Health Affairs entitled Health Insurance Coverage Projections for the U.S. Population and Sources of Coverage by Age, 2024 to 2034. The research provides crucial insights into the future of health insurance coverage in the United States. The congressional budget projects that by 2024, 92.3% of the U.S. population will have health insurance. However, this percentage is expected to decrease to 91.1% by 2034. The decline is attributed to several factors, including the end of pandemic-related Medicaid policies, changes in the ACA subsidies, and increased immigration. Interestingly, employment-based insurance is projected to remain the largest source of coverage. However, we'll see a significant growth in Medicare enrollment due to the aging population. The study also predicts that marketplace enrollment will peak in 2025 before starting to decline. A concerning trend is that younger adults are expected to see the highest rise in uninsurance rates. This could have significant implications for employers trying to attract and retain younger talent. The implications of this study points towards increased pressure on employers to provide comprehensive health insurance, especially for attraction and retention of younger workers. It may also lead to higher healthcare costs for employers as more people rely on employer-sponsored insurance. One approach worth exploring is reviewing and potentially enhancing health insurance offerings to ensure they remain competitive, particularly for younger employees who might be at higher risk of being uninsured. Our third study, published in the American Journal of Industrial Medicine, is entitled Multiple Forms of Perceived Job Discrimination and Hypertension Risk Among Employed Women, Findings from the Sister Study. This research used data from over 16,000 participants in the sister study to explore the link between job discrimination and hypertension risk among women. The findings are concerning. About 10.5% of participants reported experiencing job discrimination in the past 5 years. Over a median follow-up period of 9.7 years, nearly 20% of participants developed incident hypertension. The study found that job discrimination, particularly based on race, gender, age, sexual orientation, or health status was associated with a 14% higher risk of hypertension. Black participants, those with worse self-related health, and lower-income individuals reported higher instances of discrimination. For employers, these results highlight potential increased health risks and legal liabilities if workplace discrimination is not actively addressed. It emphasizes the importance of creating an inclusive work environment, not just for ethical reasons, but for employee health as well. To address this, organizations may want to consider implementing a confidential reporting system for workplace discrimination incidents, allowing them to address issues promptly and maintain a healthier work environment overall. Next, we have a study from the Journal of Values-Based Leadership entitled Remote Work: How Leaders Impact Employee Well-Being. This research investigates the crucial role of leadership behavior in the well-being of remote workers, particularly focusing on feelings of loneliness and the intention to quit. The study surveyed remote U.S. workers and found that a strong leader-member exchange significantly reduces feelings of loneliness and decreases turnover intentions among remote employees. In other words, high-quality interactions between leaders and their remote team members can mitigate the negative effects of isolation often associated with remote work. These findings highlight the critical role of leadership in supporting remote employees' well-being and retention. It's not just about providing the right tools for remote work, but it's also about fostering a strong, communicative relationship within the team. Key takeaway for employers is that the success of remote work arrangements may depend heavily on your leadership quality. This suggests a need for increased investment in leadership development and training to ensure effective management of remote teams and maintain employee well-being. A valuable initiative could be training managers to conduct effective, empathetic one-on-one video check-ins with remote team members at least weekly. Our fifth study comes from the Southwestern Mass Communication Journal, entitled You're No Longer on Mute: Social Norms, Generational Differences, Working from Home, and the Acceptance of Workplace Communication and Collaboration Technologies. This research surveyed 425 U.S. employees to understand factors influencing the adoption of workplace communication technologies. Interestingly, the study found that subjective norms, like employees' perceptions of their colleagues and organizations' expectations, most strongly influence intentions to use workplace communication technologies. This factor outweighed even perceived usefulness or ease of use of these technologies. Another fascinating finding is that all generations found those tools valuable with no significant age differences in adoption. This challenges the common assumption that older workers might struggle more with new technologies. The study also revealed that remote and hybrid workers rated these technologies as more useful and easier to use compared to in-office workers. This underscores the critical role these tools play in enabling effective remote work. The results indicate that the adoption of new workplace technologies is more about organizational culture than preferences or generational differences. This suggests that employers may need to focus on creating a culture that values and expects the use of these tools to ensure successful implementation. An effective strategy to consider is creating a tech champion program where employees who excel at using these communication tools can mentor their colleagues, fostering a culture of peer learning and technology adoption. Our final study for today, published in the American Journal of Occupational Therapy, is entitled Whole Day Workload: Evaluation of a New Outcome Measure in Occupational Therapy for Adults with Type 1 Diabetes. This research validates using averaged daily NASA Task Load Index measures to assess typical workload for adults with type 1 diabetes. The study found that a higher workload was linked to increased stress, fatigue, and poorer blood glucose control. While workload wasn't directly tied to diabetes self-management behaviors, its association with stress and blood glucose levels suggests it may indirectly affect condition management. These findings have important implications for how we think about supporting employees with chronic conditions like type 1 diabetes in the workplace. It's not just about accommodating their medical needs, but also considering how overall workload and stress can impact their health management. From an employer's perspective, these findings suggest that the traditional accommodations for employees with chronic conditions like type 1 diabetes may not be sufficient. There may be a need to consider overall workload and stress levels as part of the strategy to support these employees and maintain their productivity. One concrete action employers can take is providing quiet, private spaces in the office where employees with type 1 diabetes can comfortably monitor their blood glucose levels and administer insulin as needed, helping to reduce stress associated with managing their condition at work. We hope you found the insights valuable and the research thought-provoking. If you enjoyed today's episode, please subscribe to our podcast and leave us a review. Your feedback helps us to improve and bring you the content you need. Don't forget to share this podcast with your colleagues and network. Join us next time as we continue to explore the latest trends and research in employee health and well-being and workplace productivity. Until then, stay curious and keep learning.